19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to the Manager of Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning. Thank you for joining us at the Ministry of Health's virtual media conference on the national COVID-19 response. Today we have Dr. Roshan Parasram, Chief Medical Officer, Dr. Lisa Indar, who is the Director of Surveillance, Disease Prevention and Control Division at CARPHA, the Caribbean Public Health Agency, and Dr. Joanne Paul, Head of Department for the Pediatric Emergency Department at the Eric Williams Medical Sciences Complex. I'm Candice Alcantara, Manager of Corporate Communication at the Ministry of Health, and I will moderate this morning's conference. We begin with the clinical update from Dr. Parasram.
Hi, good morning. Thank you, Ms. Alcantara. So, good morning, Dr. Indar and Dr. Paul, members of the media, members of the viewing and listening public. I'll go briefly into the clinical update, and then I'll speak a little bit about the use of a pulse oximeter machine again, just to ensure that persons who have it at home are using it appropriately. So with regards to the clinical update, we start with the total number of tests done so far. Unique patients, 31,483. Private tests are now at 17,227. Total number of positives, 5,297. Total number of patients recovered, 3,652. Total number of active positive cases, 1,549. Number of deaths now stand at 96. The new positives over the last 24 hours are 16. Total hospitalized patients, 81. Those at step-down facilities, 55. At the quarantine facilities, we have 299 persons. Total persons in home isolation at this time, 1,413. As it relates to a further breakdown with regards to the facilities, we have at the hospitals 81, spread between different facilities. At the Couva Hospital and Multi-Training Facility, we have 57 persons. 5 of those are in ICU, 9 in the high dependency unit. At Cora, there are 20 persons. Arima General Hospital, there's 1 individual at ICU. No one at Augustus Long at this time, or St. Anne's Hospital. Scarborough Regional Hospital at the Fort, there are 3 persons, none at Signal Hill. With regards to step down, the Claxton Bay Correctional Facility, there are 26 persons. At the UWI Day campus, 12 individuals, and in Tobago, 17. So our quarantine persons repatriated, stands now at 299. At the Chancellor Hotel, 21 persons. At the Cascadia Hotel, 38. Homer Football, 40. Regent Star Hotel, 56. Paria Suite, 70. Tebe Halls, 41. And UWI Freedom Hall, 33. With regards to the use of the pulse oximeter, Dr. Fraser would have gone into some detail before. So the pulse oximeter, if you can see it, it's a very small device. It is portable, so you can have it with you at all times if you wish. It works on a battery, so it's a small device. We'll go into a couple slides now to basically show you. So this is the first slide, which tells you a little bit about the device itself. It is a clinical tool, clinical medical device that is painless to use. It measures both the pulse as well as your oxygen saturation. How you use it is basically you place any of your fingers, predominantly your index, middle or ring finger, into the device for a couple seconds, and then on the screen itself you see a reading that comes up which gives you both your pulse as well as your oxygen saturation, tells you your blood oxygen saturation level at that point in time. So we are advising those who have it at home, the home isolated patients. As you noted, we have over about 1,500 persons in home isolation. The Ministry of Health now has in total just over 5,000 devices that we can distribute to the population. So we have given out those to those individuals. We ask that you test yourself at least twice a day. Only takes a few seconds, it's very painless. You can do it more than that if you wish. Also, of course, if you're getting difficulty in breathing or any clinical worsening of your symptoms, you can test it. Next slide. So what is considered normal oxygen level? So levels above 95%, which is the reading you'll see coming up on the machine labeled SpO2 with a percent sign. It must be 95% and above. And your pulse, which will come up above, is 60 beats usually to 100 for an adult. Dr. Paul can go into a little more detail in terms of children, but children, as you go different ages, the pulse changes. With very small babies, newborns, pulses are expected to be in excess of 100. Oxygen saturations of 94% or less. We are asking you to contact either the CMOH office provider that would have been in contact with you throughout, or call 811. In terms of your pulse, consistently more than 100 beats per minute means there's something amiss in terms of your cardiopulmonary system. Last slide. So again, all abnormal readings should be reported to the medical team that is monitoring you at home. And if you cannot get onto the medical team, you call 811, which is the ambulance service, and report your symptoms and the results of the test. Just lastly, to explain why it is so important to use the pulse oximeter in COVID-19. So in other viral illnesses, in other diseases, you find that if there's a deficiency of oxygen saturation in your blood, it stimulates a center in your brain called the respiratory center, which causes you to feel short of breath, increase the rate of breathing, and allows basically more oxygen to be drawn in and pulled into your body so that that whole system responds. With COVID-19, we know there's a special condition called silent hypoxia, which means that your respiratory center is not getting the message that the oxygen saturations are low and cannot respond adequately. That's why we're using a clinical device that will be able to monitor it objectively without symptoms so that you can know when you're getting worse in terms of your respiratory saturation. Ms. Alcantara, that's my update for this morning.
Thank you very much, CMO. And now we go to Dr. Indar, who will reinforce the importance of the personal protective health measures.
Good morning, everyone. I want to thank the Ministry of Health for inviting us here from the Caribbean Public Health Agency. Today, I want to reinforce the importance of public health, COVID-19 prevention and control measures as the economy reopens. First slide. CARPHA's job, or CARPHA's role, is to provide technical support and guidance for our member states as they mitigate COVID response. As countries are reopening, we recently produced a document that is on your screen called the Regional COVID-19 Public Health Considerations for Opening Borders. Now, in this document, it talks about the responsibilities of the different sectors. So, for instance, under the Health or Ministry of Health, their responsibility is to enhance the surveillance and monitoring and do testing and do contact tracing and ensure, adequate response for if someone is ill. Their responsibility, too, is to also provide adequate quarantine measures. But what I want to focus today is what is the response for you, our public health. Next slide. Now, we all know that COVID-19 is a virus. And we all know that virus spreads from person to person. So think of COVID as the common cold, for instance. When your children has a cold, if someone is sick, the first thing you tell people is to stay apart. Well, COVID is transmitted from person to person between tiny respiratory droplets and through contact routes. So I want to reemphasize these following public health measures that you meaning that you as the public health are key to reducing or stopping the transmission for COVID-19. The first is this big word we have been hearing, social distance or physical distance. Well, to put it down in Trini terms is to stay apart. We want to stay apart, or we want to keep at least 2 meters away from persons. And why is that important? Well, if someone is speaking, or if someone is coughing, or if someone is singing or talking loud, those tiny droplets those COVID-19 droplets, if someone is sick, it can transfer into the air. And if someone is near to that person, they can easily pick it up through that airborne route. So you want to stay apart. So if we are staying apart, so all those things that we Trinis like to do, hugging and touching and handshaking and all of that, we have to then change those habits as part of our new norm. So no longer, are we hugging and kissing and touching or are we staying in close contact? And if we are doing that as well, it means we have to avoid these mass gatherings. You know, the limes down by the beaches or the house limes that we tend to have, you know, any one of those gatherings that involves people who are not in your normal family, that is in your household family, those gatherings should be avoided. The second is hand hygiene. So we talk about hand washing, and you know, this is the key. In fact, it is the major prevention measures for all viruses. You want to wash your hands properly, and you want to wash your hands frequently. Now, you know, there are many different information that comes out there about hand washing, but hand washing is a 30-second process. You have to lather under running water, you have to lather your hands properly, and you must scrub your hands for 15 seconds with liquid soap. And following that, you rinse, and then you dry off, and then you sanitize. So how often do you wash your hands? Every time you change your task, you wash your hands. Every time you go to the washroom, every time you touch something that you should not touch, you wash your hands. It is the single most important tool in terms of prevention. The third is mask. So we know there is a lot of contention and back and forth. Why should we wear masks? Well, because COVID is spread through these respiratory droplets when we speak or when we talk or when we sing and so on. We want to then prevent someone from being infected if we are sick, and you want to prevent yourself from infecting others. So the mask then is a very important tool in terms of preventing that infection. If you wear this mask, you are then preventing those droplets. If you are sick, from infecting others, or if someone is sick, you are preventing yourself from getting sick. So it is very, very important. We cannot re-emphasize, the need to wear your mask at all times, especially when you are in public. The fourth is, if you are coughing and sneezing, you want to practice proper cough and sneeze etiquette. You cough into a napkin, a disposable napkin, or you cough, on your elbows. And the fifth is, if you are sick, seek medical attention. And number 6, stay at home. We still have persons, in countries who get up and decide, well, it's a mild fever, it's a mild cough, I'm going to go to work because I have something to complete. The thing is, 85% of the COVID-19 cases are mild. So you and I may be infected with COVID, we may not show symptoms, and we may be walking around with it. But then we may transmit that onto someone who is older or who may have an underlying illness, and that person may become critically ill. So we want to ensure, if you are sick, stay at home. So those are our prevention measures, and I want to emphasize here that what is stated on the slide, you are the key persons in terms of carrying out these public health measures. So while the ministry and CARPHA would continue to emphasize these public health measures, the onus is upon you. You play a big role in terms of carrying out these public health measures and breaking or denting the curve and breaking transmission. I want to just move on quickly to my last couple of slides. The slide just before that. Okay, so the slide just before that. I want to talk about another sector that is really, as we are opening, what our tourism sector is working on. CARPHA, through its tourism and health program, is working with our travel or tourism sectors in different countries. And just last week, we would have done this with Trinidad and Tobago. As we open our travel and tourism sector, which is very important for economy recovery, it is important that, the proactive health measures are adhered to. And that includes, proper training, certification, monitoring and reporting on illness. And CARPHA would have gone ahead to reward every hospitality facility, whether you be a hotel or you be a guest house or a tour operator, a taxi driver. Once you have gone through the training and you're doing the reporting, which means you're doing proactive measures, you get that Caribbean Travelers Health stamp for healthier, safer tourism. And if we go on to the next slide, that stamp, if you have that stamp, it is then shown on our Caribbean Travelers Health app. So it means every facility there will be on that green icon that you are seeing as a healthier, safer tourism option. So travelers who are coming to the Caribbean, travelers who are now coming to Trinidad, has that option that, you know what, I prefer go to this facility, or I have an option of going to a country and a facility that has a traveler's health assurance stamp. So with that, I want to thank you for your time.
Thank you very much, Dr. Indar, for giving the CARPHA perspective and reminding us of our role. We go now to Dr. Paul, who will focus on some strategies that we can use to protect our children. Move to Dr. Paul.
Thank you. Good day. Chief Medical Officer, Dr. Indar, Corporate Communications Manager, members of the media, ladies and gentlemen. I'm here today to talk about COVID updates on your children. But also, I really wanted to shift our mindset in terms of thinking about the cause and effect mentality and also the COVID normal. Now, for instance, like me, I've been dying to go to the beach. So I know you have the same things as beach. We're waiting for the rivers. We want to have our economy come back, at least restart. We want to go back to our churches. We want our kids to go back to school. We want our entertainment industry to go back to some semblance to start, because we really feel for those persons who are unemployed and struggling. The thing is that to do that, we must have a sense of COVID normal, not just a new normal, but COVID normal. We also want to have reduced deaths. So whenever the CMO reads out the list every day, as we know, I feel the same way. We go, oh, you know, there's another person who died, or we have our relatives who are COVID sick and they're severe and they're in hospital. So we don't want that. We really wanted to reduce that. We also want to reduce the amount of restrictions. We want to get out there and go back to some sense of normalcy. And so if we think about cause and effect, and this is what we want. But to do that, we have to reduce the surge of the COVID infections. So to do that, though, we have to do the new COVID normal, cause and effect. So we can't do nothing and expect to come back in terms of normal, less restrictions. We must do our new COVID normal. And I have a sort of like combination of things we can think about, just to reinforce a few things that Dr. Indar was saying, but also to put it in a form we can understand it and remember it. So think about MESS, M-E-S-S. So M stands for mask, and also hand washing. But just to, as Dr. Indar mentioned, the mask does reduce the transmission of infections. But we also have to think about it differently, where it also makes the infections milder. So for instance, if someone coughs to me and they have COVID and they cough at me, they might transmit maybe 200 viral particles. My immune system might be overwhelmed by that and I'll get severe COVID. If they have their mask on though, I might actually get no viral particles or 20. So I have 220, much less. With that amount now, I'll get mild infection because my immune system will be able to defeat the viruses faster. So not only do masks reduce the transmission or stop it, they also make it that I'll get a milder response or milder infection. And so we want to have that happen so we would not have our relatives, our family in hospital being sick. So mask first thing with hand washing, that's the M, and E, exercise and immune strength. So the fact is that there are three major things that really affect in terms of comorbidities that they've shown with regards to COVID that make a difference in terms of severity of COVID. Diabetes, first thing, obesity, second thing, and of course the vaping and smoking. So if we can do some exercise, maybe about 4 or 5 times per week, at least half an hour, any kind of exercise, just go beyond 20 minutes, get your heart rate up. I'm talking about reducing your chance of obesity or reducing the actual obesity, and also having more control over your diabetes, obesity, smoking, and vaping. And of course, it goes with immune strength. We want to have proper sleep and try to have our immune system as strong as possible. So when we get the COVID viruses in, we would be able to fight them and have mild infections. But not just COVID strength. We really, I mean, not just immune strength, we really want to have it where we do our MMR, we do our vaccinations. I'm saying, please, this is my 3 pleases, right? Not just 1 or 2, but 3. I really want us to go out there and have our flu shots. We want to have it where we're protected, have our immune system bolstered, to not have anything else and COVID. We don't want to have it where we have influenza and COVID. So go out there, have your flu shots. Parents, go out there and please have your children vaccinated. We have to make our immune system as robust as possible to make sure we don't have anything else and that we actually fight COVID. So E stands for exercise and immune strength. And of course, the first S is social distancing. And just similar to masks, the same thing. If I'm further away, if you cough at me, I'll get less viral particles. And not only would I not have I'll have reduced risk of actually getting COVID, I'll have a milder infection, which is the whole point about it. Not having a surge and also having milder infections. And the second S, so we have MESS, the second S stands for no super spreader event. I'm talking about, and I know Halloween is coming up, and I know we as Trinidadians and Tobagonians, we really want to go out there and lime and get together because that's our DNA, that's our culture. But I'm saying that if we do that, we understand cause and effect, right? If we have super spreader, if we have big limes, we have no mass, and the virus thrives on having that super spreader event. So once we have that situation, it gets more excited. There's much more spread. With more spread, we have a bigger surge of infection. What happens next? We have restrictions and we have the economy being flattened, and we don't want to go there. We really want to have it where we have cause and effect. We do our COVID normal to cause us to go back to some sense of normalcy and be able to go out there. So no super spreader event, no liming, etc. And which brings me back to Halloween. So I'm going to be a little bit strict with this. I strongly recommend that we do no trick or treating, no Halloween parties. We'll be going back in a few weeks' time. We'll spike again and we'll go back to the same situation. So imagine, if you will, we go trick or treating with our kids. We go from house to house to house. After we do that, we now have about 100 persons exposed, the same persons. Obviously, we're transferring the same virus and there's a risk of surge. So I'm saying that for those parents who are home with their kids, have Halloween, make it a new normal. Have Halloween hikes. Go on a hike with your child. Have it where you can have games night or even have movie night. You can actually stay at home and stay in your Halloween pod. So maybe a few persons, and you can actually have your mask. You can pretend anything, have games there, and you can have your sweets or non-sweets and have your own Halloween tradition. But we do not want to have that super spreader. And for the young people like me, for instance, the young adults, wink, wink, we don't really want to have it where we're having a Halloween party just for the fun to break and reduce some stress. We want to not go out there and cause super spreading, which will bring us right back. So I'm reinforcing MESS, MESS, and just the end of it, no super spreader event. In terms of the actual updates with regards to children, we've found so far that children it's almost bimodal in terms of their presentation. They can present very mild or asymptomatic, and most of the ones who have had the COVID swabbed positive have been extremely mild, no issues, and they belong to like part of a family per se who have been infected as an entire family. The other distribution, the other end of it, have been the ones who have been severe COVID or MIS-C. We had mentioned MIS-C before, which is multi-system inflammatory syndrome in children, so MIS-C. And what happens with those children, and like adults, in fact, we have seen that they do not present respiratory, rarely so. They present mostly with diarrhea. They present with their hearts beating much faster because they have a high heart rate, and also brain neurologically, neurocognitively, they might have it where they're totally drowsy, they're out of it, they might be not talking properly or saying stuff or making any sense. So the three systems we found with children that have been more involved with severe COVID or MIS-C have been gastrointestinal or your bowel. So we have bowel, we have heart beating faster, or brain being affected. Now, we have been, in terms of the Pediatric Society, and most of the staff in both of the major hospitals, in all the major hospitals, we have been really on it. We have produced our protocols. We've been aggressive with regards to our treatment, antibiotics, steroids, etc. So far, I would say between Mount Hope and also San Fernando, we probably have about 20 patients who we've found in children with regards to potential MIS-C or severe COVID, and there's been no deaths from these so far because we've been super aggressive to pick them up. So they come in lethargic, cargo, off color, and those three systems involved, not so much the respiratory system as we know. But we've been on top of it because we know we want to have it where we take care of your children as best as we can with our expertise. And the last point is what the CMO was alluding to, which was mentioned before, in terms of the heart rate to look for when you have the oxygen saturation probe. For children, the older they are, so if you have an adolescent who's about 14 and over, you're looking for the same heart rate as with the adult, 60, 70, etc. And for the younger child, it goes to maybe 120, 130. So there's really a range between 70 and 130. So I prefer to think about as your mark. So if they're above 180, that's bad. If they're less than 60, in a child who's less than 14 years old, that's bad also. So 180 and above or less than 60 are things you think about in terms of not the normal heart rate. So just to reinforce a few things in terms of micro summary. 1, no super spreader event. I recommend strongly we stay at home for Halloween. This is really serious. We want to go back. We want to join in with the COVID normal to be able to have our restrictions lifted. Number 2, think about mess. M, mask and hand washing. Wear your mask and hand washing. E, exercise and immune strength. S, social distancing. And the second S is no super spreader event. The reality is that COVID is here until maybe next year, and we have to have a new COVID normal, and we have to do this together. Thank you very much.
Thank you very much, Dr. Paul, for reminding us about ways that we can use to protect our children. And we begin the question and answer segment now. I invite media representatives. Indicate your name and the media house that you represent before posing your question. Of course, in the interest of time, we ask for a maximum of 2 brief questions per media house as we begin with TTT, please.
Good morning, everyone. Crystal Wilson, TTT Limited. 2 quick questions. Have provisions been made to send medical personnel to various senior citizens' homes to administer the flu shots instead of them having to visit the various health centers? And also, some time ago, it was mentioned by the Ministry of Health that they were looking at measures to ensure that businesses offer to members of the public hand sanitizers and soap that met public health standards. Do we know if this has been done? Thank you.
Okay. So in terms of the senior citizens, a normal practice with immunization programs is that there's a district health visitor-led program that actually does outreach programs, which includes geriatric homes and other places. So that is entrained through the offices of the CMOH. In terms of your hand sanitizers, the Chief Public Health Inspector, through his inspectorate, was providing us with a series of monitoring and evaluation reports, which detail basically they actually look at the hand sanitizer being used, the types of soap being used, and they suggest to the persons in those institutions what are the best types to be used at any given time, and they provide a report indicating, to the most part, we have general compliance above 80% in all those places that were visited, so 80 to 90% in most instances.
Thank you very much, CMO. And we go now to one of the daily newspapers. Newsday, please. We're ready for your questions. We just await. Are we ready with Newsday?
Hi, good morning all. Shane Zuberville from the Newsday newspaper here. I have 2 really quick questions, both for the Chief Medical Officer. I don't know if Dr. Indar would care to weigh in on either one of them. They have to do with the issue of reinfection. I just wanted to know, to date, has there been any cases of reinfection? And if so, what are some of the key factors or features that the ministry has noticed in terms of which demographics may be at greater risk for reinfection post-recovery? That's all.
Okay. There has been one particular detailed event worldwide, not in Trinidad, that has shown an instance where someone has been reinfected with an additional strain of the virus in the US, I believe. In Trinidad, we are not to the stage that we are doing subtyping as yet, so it is difficult for us to tell whether there has been reinfection at this point, but we have seen a couple cases, as I noted before, that persons would have recovered by way of having their negative tests in the early phase 1 represented for another reason without symptoms and tested again, turning out to be positive. What we had noted when Professor Carrington was on the program is that there could be lingering particles, viral particles, that could be picked up months, sometimes quite a long time after the person has recovered. We are not sure if that is an infective process as yet, but there's at least one incidence worldwide that we have had reinfection occurring. Dr. Indar?
Yes, so to just add to what the CMO just indicated, there isn't, this COVID virus is new, so we are learning as we go along. You know, it's not like we have it well established as yet. There is no data that really, associates reinfection with, with any particular factor as yet. So the case that we do have outside of Trinidad, it's not enough to say reinfection is because of or associated with these factors. So this then again reemphasizes the need for you, the public health, to enforce these public health measures to prevent reinfection as much as possible as well.
Thank you very much, Dr. Indar. And now CNC3, please.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so my two questions would be for Dr. Parasram, but I am willing to let Ms. Indar weigh in on it if she can. The first one, Dr. Parasram, is within recent times, as the curve has begun to show its plateauing, we've seen less number of persons being tested on a daily basis compared to what we would have seen at the peak. Now, I know that the ministry has maintained only symptomatic people would be tested, and it's a function of those who come out to be tested. But is there anything that the ministry is looking at to probably widen the pool or widen the way in which they reach out and test people? Because clearly the virus is still within our population. And the second question, Ms. Indar mentioned a bit about the travel and tourism industry and some protocols and conversations, and Dr. Paul even mentioned a bit about adhering to the protocols even in a more relaxed state of things. So is this some sort of foreshadowing to what we could be hearing on Saturday coming from the Prime Minister as we come to the end of this period? And also, if you could answer within that, could you give us some idea of what recommendations has the Ministry of Health made to the Prime Minister for Saturday's review?
Okay, so in regards, I know we spoke about the testing issue prior. There's been some recent evidence from WHO that WHO is saying out of a study from Singapore that they are heavily leaning towards thinking that the asymptomatic person has very little to do with the spread of this epidemic. I don't know if you have noted that particular publication from WHO, which leans us more to believe that our testing strategy is in alignment with what should be done, meaning that you test persons with viral symptoms predominantly first, and then of course primary contacts or secondary contacts who are significant contacts of those cases. We may allow for some asymptomatic testing to be done, but the utility of general widespread testing of the asymptomatic population is not something that is necessarily the best place to go. Testing hospitalized patients is one opt-out sort of therapy that we have used for HIV as a way to do population-level surveys. So it is one way we can do some testing as well, additionally. We haven't gone into it as yet, but it's being explored to some extent. So that is one avenue that we can look to, where you may get persons presenting with other types of symptoms, for instance, cardiovascular disease, cerebrovascular accidents where we have seen in some instances we have gotten some positive cases. So it may be worthwhile to explore that avenue. With regards to, as you know, we try not to preempt what the Prime Minister is going to say. We give our health recommendations, and then he takes all things into consideration before he makes his deliberations on Saturday. So I don't want to go into it in any detail, but what Dr. Indar has shared is the Tourism and Health Program, which is established by CAFA. Trinidad is a signatory to that program, so if and when we open various sectors, we have that to fall back on. So basically what it means is that those hotels, those places that have signed up for the THP program now are able to detect. If they detect cases, they report it back to the Caribbean Public Health Agency electronically, and that data comes to us. So it is a surveillance system that picks up cases early, so it gives us a little bit of confidence in the system, at least for those places that have signed up, that we can pick up the disease early enough and test. Mm-hmm. Dr. Indar, you want to?
Yes. And to add to that, may I call you Rishad? Mm-hmm. Yes, to add to that, Rishad. So getting on, I will just go to the last questions first. The Travelers Health Program really it's a web-based early warning and response system. So it's real time. It's at your fingertips. You can get it on your phone. And we really encourage not just the hotels, but the guest houses and the tour operators and so on. You know, we are not asking them to be doctors, but it's really their reporting symptoms. And the system does its own calculation. But more importantly, relevant persons in Ministry of Health knows instantly what's happening. It's real time flow of information. So, you know, you want to stop something before it spreads. And because, you know, we are dealing with viral illness, you know, spread among people could go very quickly and you can have, you know, a big increase very fast. So you want to ensure that you are reducing that spread as much as possible, you know, if it really means to isolate or to do any other public health prevention messages. And not to get into testing, but the key now, you know, Trinidad has already established that COVID is in Trinidad and there is community transmission. Trinidad has established that. The key for us is to break transmission. To break transmission, we have to do prevention and control. And, you know, if the media take nothing from here today, is to really emphasize what we, the public, can do. We have to really emphasize, you know, the social distancing and the mask and the hand hygiene and so on. And not just when people are looking, but when people are not looking. You know, how do we really keep that, you know, social distance? How do we really avoid these, you know, these social gatherings, you know, down at the beach and so on, that people still think they are getting away with it? But the more we encourage that, the more we encourage spread. So those are the things we want to really put a stop on or to reduce, so we can reduce transmission.
Thank you very much, CMO and Dr. Indar. And we move now to Tobago Channel 5 in the Sister Isle.
Hi, good morning. Candice Jackson from Tobago Channel 5. My question is for Dr. Indar, and it's in regards to the testing, the app thing for the businesses, the hotel, the tourism-based businesses. Can you give us an idea of how many businesses have volunteered for this, and what is the process for doing this?
Okay, so it's a couple of things. The Travelers Health Program is a voluntary registration where any tourism establishment can actually register. Now, we would have revamped the process, and just last week we had a training facilitated by the Ministry of Tourism as well as the Hotel Association. So this process has started. Getting involved in the Travelers Health Program allows for two things. It allows you to be able to do the COVID-19 health training. It's a certification training. So it tells you all the different prevention and hospitality industry should take from the time someone reaches the airport to the time they leave. You know, it takes you across that path so that you're protecting the visitor as well as protecting yourself. So that's one. And it then tells you how to use that, you know, electronic report system that you can use on your phone. If they do those two, CAFA and the Caribbean Hotel Association and the Caribbean Tourism Organization is offering this Caribbean Travelers Health Stamp. You know, everybody wants a stamp in terms of as a reward or recognition system. And we are working to have this recognition system also be recognized globally by the World Travel Tourism Council. But the key is the process is to first do the training, get onto the system, and the stamp would be awarded. Once it's awarded, you would see it on the app, or the hotels and tourism establishments will be notified. So that's the process. We have just started. So I can't give you all the exact numbers, but the process has been started, and I think that, it's a way through working with Ministry of Health and Ministry of Tourism to get us prepared for when our economy reopens.
Thank you very much, Dr. Indar. A clear indication there of whole of society approach to dealing with COVID-19. And we go next to Express newspaper, please.
Good morning, Kim Woodrum from the Express.
Good morning.
CMO, this is not a new question. I hope it's not too vague, but if we could just look at what's happening with China right now, and not to make simplistic comparisons between the countries, China is taking some very drastic action. It's also costing them a lot to keep their transmissions down. So we are seeing them attempting an economic rebound. So the question would be, what are we not doing then that would allow us to make some moves in terms of reopening the economy, etc., like China at this time, if I dare say, given our size, our population, with due respect to all that's already been done? I hope that's clear. Second question, if Dr. Indar would like to weigh in, it's also not new, but there's a very particular type of anxiety, possibly depression, affecting quite a number of students because of issues with their CSEC CAPE results. That's been coming up quite a bit from parents expressing deep concern at what they're seeing with their teenagers, given the circumstances of the pandemic. So if we could revisit that issue, advice for parents, yes, point them in a direction perhaps that they could begin to cope, because it's a lot for them from what we get. Thank you.
Yeah, so just to answer your first question, so basically I think Dr. Paul and Dr. Indar had spoken greatly on basically what civil society can do. We all have to do the right thing. We all have to wear our masks. We all have to sanitize. We have to stay away from workplaces and schools when we are ill. We have to do the new normal. If the more we can do the new normal as a society, if we can get up to 90% of persons doing the new normal all the time, then of course we can reopen larger parts of the economy safely. So it really depends on how much the population is willing to give in terms of conforming to the new normal. If there's, and we saw it in the past, if there are large congregations of people not wearing masks, not doing social distancing, and you get the persons with the virus in those environments, you will have a spike. There's no doubt about it. The virus is very pervasive. It looks at weaknesses in the human chain and it will exploit it. And it has done so in all parts of the world. China was very strict in the way they tried to control for a very long period of time to contain the virus. They would have had lockdowns in place. There's the contrary, what happened in Sweden. People thought they remained open most of the time, but now we're seeing that Sweden now has, months later, the highest per capita death rate in the world. One of the highest, 52%. So it really is striking a balance in the way that we open the economy, but we have to do so safely, ensuring there's learned behavior occurring so that people can do the new normal when they go to the workplace and to places of entertainment. Dr. Indar?
I have nothing further to add, CM.
Second question.
I think we had the second question from Ms. Budram about students and some of the difficulties the students are facing. Ms. Budram, does that take into account your second question?
Yes, thank you. It's just that within the last, I would say, fortnight, the reports from parents of really severe depression, anxiety, where we were using common words, seem to be affecting a lot more students, CAPE and CSEC in particular, and then the added stress of the pandemic in the context of their futures. So it would really be to ask, is there going to be an increase then, if I could put it that way, in provisions for parents and students, counseling, guidance to cope with this going forward?
Okay, so great, thank you.
I think that specific question is really for the Ministry of Education, but Dr. Otello would have touched on the instances, not necessarily in the pediatric population, but in general, in terms of rising rates of depression and anxiety worldwide, and of course in Trinidad as well. So it is something that we are keeping a very close eye on from the health sector and ensuring that we have mechanisms in place that can deal with the increased rates of these illnesses.
Thank you very much. And we move to IETV, please.
Good morning, everyone. Binama here from IETV News. Are you hearing me?
Yeah. Yes, we are.
Okay, great. So my first question is for Dr. Paul. Dr. Paul, I know this may be a general question. For example, parents whose children are taken for medical attention at the various pediatric facilities for non-related COVID illnesses. For example, if they have a broken arm or they need to have a surgery done, what is the process for parents and children if their children needs to be warded? Do they have to be swabbed as well? What's the protocol in the wards for children? And my second question is to Dr. Parasram. Can you give us an update on the staff who are in charge of the COVID facilities, for example, the doctors, the nurses, and the auxiliary staff? I know earlier on when the pandemic began, a lot of staff were complaining that they were overworked and they were working long hours. Has that situation been sorted out? Thank you.
Thank you. We go to Dr. Paul to respond to the first question, please.
Thanks for that. In terms of the children who have come through with non-COVID symptoms per se, remember we mentioned before that children can present with really vague symptoms and they still can be COVID positive, or they can present very asymptomatic. So even if my child comes in with a broken finger or broken hand, they can still be COVID positive. So if we have to test though, we have to test everyone because any child can be. So what we're doing now, we're not testing everyone, obviously. What we're doing is that presuming, as I tell the entire population, presume the other person next to you is potentially COVID. And so therefore we have told our staff, and everybody has to wear a mask. So staff, patients, everybody wear masks, do hand washing and social distancing, presuming that that child is COVID, potentially COVID positive. So as it is, if they have no signs and symptoms, we go through that one parallel, that system where they go on the ward, and we still maintain all our precautions. If they do have symptomatology, respiratory, but also if they present with diarrhea, or if they present especially with two symptoms. So even if I come in with maybe abdominal pain and I seem to have something else like a cough per se, then the staff will think it's two things and you may be more at risk of COVID, and then we'll swab you. So usually with our criteria, it's two systems involved, or you have a contact of COVID, or you're very sick, and that's the ones we're saying let's test and see. But otherwise, we can't do it because we'll test everyone. But we're treating everyone as if they potentially are COVID. I hope that answers your question. Yeah, thank you.
Thank you very much.
In terms of your staff problem, what the ministry has been working together with the CEOs of the RHAs to ensure that there's enough staff at the facilities so that it will allow for appropriate rotation and allocation. But more importantly, again, if we get the national numbers down, and as you would have seen from this morning's report, we only had 57 persons at the Couva Hospital, for example. There was no one at Augustus Long, there was no one at the facility in St. Anne's. If there are no COVID positive patients, the staff inadvertently gets a lot of relief from their workload. So we are hoping to get the numbers nationally down, keep the hospital levels low, so that basically the staff can provide some respite in terms of the way they have been working continuously, and really they go beyond the call of duty at all those institutions since the early part of the epidemic, and they have been working round the clock to ensure that our ICUs the needs are met of all our patients. What the population can do is we try to get the numbers down as quickly as we can by following the public health measures, so we get those facilities empty again and give those staff who deserve it a long-deserved break.
Thank you very much, CMO. And we move to CL Communications, please.
Hi, good morning, everybody.
Good morning.
I just have a very small question for Dr. Indar. concerning the stamp, the tourism stamp. How many Caribbean territories have that stamp, and what territories overseas, internationally, is the stamp advertised in so that they would know about the stamp? And then lastly, to what extent is CAFA assisting Caribbean countries in their efforts to open back again? Thank you.
Okay. Thank you. Thank you very much. So in the presentation, the stamp is to be launched on November 5th. So it's not yet launched. You would see a press release that comes out actually tomorrow that speaks about the Traveler's Health Stamp, but it's a verifiable and measurable stamp. It's the only one like it in the world where you measure and you can verify. It means that facility is doing implementing COVID-19 public health prevention measures, as well as the reporting illness in real time. So we are working through CAFA as a regional agency, are working through all our member states through Ministry of Health and Ministry of Tourism. We're encouraging that partnership. So it's not just tourism, but it's really that all a society approach where this becomes part of their normal surveillance to implement. We have many countries. We have about 13 countries that are involved in the program. And I suspect once this is launched in a couple of weeks, that, it would go globally. The launch will be global, not just with our CHT and CTO, but it will be an international launch. So, and CAFA is working through with all our member states. We put out a lot of different materials. I would urge you to go onto our website, cafa.org. We have, for instance, over 32 guidelines that speaks about reopening, and it's not just reopening for the hospitality sector, but reopening of businesses and different areas, different sectors. So it allows you, it provides this science, and with that comes a suite of different infographics that you can use. There is a lot of resources out there. You don't have to reinvent the wheel. So CAFA is providing these reopening measures. And the other thing CAFA is doing, we now have something called the COVID-19 health rungs, and yours truly, your CMO, will be in one of these rungs come this Wednesday. So I'm advertising it as we speak. That really speaks about how we prepare countries to mitigate and to respond to COVID. Every week we run sessions, and it's run regionally, and it's run globally for anybody. The links are sent to anybody who wants to actually participate. So thank you very much.
Thank you very much, Dr. Indar. We move now to AZP News, please.
Hi, good morning, everyone. Priya Bihari, AZP News. Adewale CMO, has the backlog in the reporting of the testing, has that been cleared up? And how is that reporting done now? And I'm in the context of, I think 2 weeks ago, when there were only 3 cases reported, right? And that happened to be budget day. And after that, there were quite a number of cases, and before quite a number of cases reported. Is it that sometimes, the lab or the ministry chooses to report some cases today and the rest tomorrow, or is it all the cases that you all have, they are reported immediately? Thank you.
Okay, so reporting, when we speak about reporting, we're talking about the reports that we see coming out on a daily basis, reports of positive cases that come out based every day. Well, now we have a press release that is done at 4 o'clock every day between 1 or 2 p.m. Email comes from the director of the Trinidad Public Health Lab to the corporate communications unit, as well as myself, which indicates how many positives we would have had over the last 24 hours. So that is done at the same time every day. It doesn't, so everything we have up to that particular cutoff time from the day before, we report all of those positives during that period of time. The negatives, if you want to talk about the reporting of negatives, those go to the CMOH offices and are reported as soon as they get it to the clients as they come in.
Thank you very much. And we move to I-95.5 for 2 brief questions, please.
Yes, good morning, Whitfield Turner, I-95.5. Just wanted to find out, CMO, we now have tours to the Caronia Swamp and the Buku Reef. Was any consideration given to restarting tours to Little Tobago? In that case, we don't have to physically enter the water, as is the case in some instances with the reef tours, and they're able to observe all the health protocols in terms of physical distancing and so on. So I just wanted to find out if consideration has been given or will be given towards restarting tours to Little Tobago.
Okay. So, I mean, consideration will be given to all tours, I think, notwithstanding Little Tobago as well. We will have to look at all boat tours in general. Again, I am hoping to have a committee meeting later on this week to discuss it with all relevant parties. And then, of course, we will make a recommendation to the Prime Minister later, just before the Saturday press conference.
Thank you very much. And I think we can squeeze in one question from CNC3. One last quick question from CNC3, please.
Okay, thank you again. So just quickly, just your comments, CMO. A large part of everything that we are doing depends on public responsibility, especially when it comes to wanting to relax measures and stuff. But from what you've seen so far throughout this pandemic, would you be willing to comment and say if you think our population has been responsible enough or is responsible enough for us to move forward with any loosening up of measures?
I think with the legislation in place for masks, and of course, I think a large majority of the population has been compliant with the public health regulations. We are learning a new behavior over months. The world, not only Trinidad, I think we are getting to the place that we can reopen safely, much more so than we would have been able to do maybe in March or April. So it is a learned new behavior we are asking people to do. So we are getting there. But of course, the more we can do it, the greater the number of persons that can comply with the public health measures, the faster we can return to some level of normalcy.
Thank you very much, everyone. We have come to the end of today's media conference, and the message is strong and clear. We all have a part to play. So please get your flu vaccine, follow all the measures, and of course, wear your mask.